Hello there, friends. Just me today. I figured I would fill you in on what's going on with my fertility stuff before we get into the exciting next adventure, which is Sam's egg retrieval. It's just a few days away, and we will be updating you very shortly. You'll see an entire video of day by day or every other day of Sam's second IVF cycle. But before we get into that, I figured I would tell you about my results from my HSG test that I had about 2 weeks ago, I would say. So let's get into this. So as I've mentioned a few times, I am planning on doing an egg retrieval or two this coming summer. Right now it is mid-April, and we really wanted to focus on doing egg retrievals for Sam since she's gonna carry first. So we've really been focusing on those egg retrievals, and the first one didn't work. The second one is happening right now or pretty soon, and then we might do a third one depending on her numbers, how many embryos actually fertilize and survive, possibly after the cruise, so maybe in May. It just kind of depends on what the numbers look like and how confident we feel in the embryos that we have. But we will be doing some egg retrievals for me, or at least I'll be doing them. So I wanted to check in with my doctor pretty much as soon as the HSG test was completed, because the doctor who completed it talked to me afterwards and told me that my left side was completely blocked. He said that my left fallopian tube was 100% blocked. There was absolutely no way that the fluid was getting through, and that that would have to be something to talk about with my doctor afterwards. So I waited a few days. I didn't really get any results back necessarily, but because I already had that information, I reached out to my doctor. I'm sure we've mentioned it a few times. We have a messaging system, which is kind of like inboxing. They're not quite emails, but we do have an app, or we have online portal where we're able to send messages, receive messages, look at our medication, and do all sorts of things. Anyway, so I sent a message to my doctor and said, "Hello, Dr. So-and-so. I am sending a message to follow up with my HSG test results. I know that you don't, I know I don't yet formally have the results, which I still don't, which is kind of weird, but I know the doctor did let me know that my tube is completely blocked on the left side. I was just wondering what that will mean for my next steps in my fertility process. Will I need to have that removed before beginning an egg retrieval? Will I need surgery? I want to make sure that I am all set to begin stimulating at the end of May. Also, when you had my AMH tested, was my FSH also tested? I was wondering if my low AMH means that I have low quality in eggs or just the low number. Now, I know from a lot of research and reading that low AMH does not mean that you have low quality. I know that that is just the quantity, and that the FSH is really what shows quality, as well as the antral follicles, like quantity quality. But I didn't want to act like I Google everything in the world, so I just asked that question. So her response will answer, but it does, I just wanted to show that I kind of know what I'm talking about, but I didn't want to act like I've been Googling all of the things that I probably shouldn't be Googling. So she responded, I think the next day or 2 days later, and she said, "Hello there. I apologize for my delay. I was just reviewing these images last night. I agreed that the left tube is blocked and dilated and should come out surgically prior to getting pregnant. It can be before or after your retrieval, just prior to trying to get pregnant. If there is any chance that you would want to do an embryo transfer or convert a poor response cycle to an IUI, then we should remove it beforehand. Otherwise, this is not urgent, but we see better pregnancy rates after a Hydrosalpinx is removed, which is the blockage that I have. You should just let me know when or if you would like to do this. And then she says, AMH is a measure of egg quantity and not quality. I know this. Your FSH was not tested, but I would recommend doing this. FSH needs to be checked on the 3rd day of your cycle. Hope this helps. Please let me know if you have any other questions. Now, as far as the FSH goes, it's really difficult because I've had an IUD, the Mirena, for the last 6.5 years. It is expired now, but my doctor previous to going to the reproductive endocrinologist said that it can still be effective in regulating your cycle even after it is expired. Especially because I don't need it as a contraception. It's okay to leave it in until I'm ready to switch it out or just have it removed for fertility reasons. So that's actually how I got into all of this. And if you have been watching our videos for a little while, or if you're going to go back through and look at our videos from before, there was a video, I believe it was something like empanadas and ultrasounds or something. It was one of the days that I had an ultrasound to check my fallopian tubes and see what was going on with all of that. So I'll link that up here if you're interested in taking a look. But I did have an ultrasound way back when to figure out where my IUD went. I went in to see if they should remove it a while back, and the doctor couldn't find it. She asked if it had fallen out or maybe it had traveled up, I don't know. And I was like, no, I'm pretty sure it's up there. So I did an ultrasound, and they realized that there was possibly a cyst in my tube or on my tube. And then it was right around that time that we had our first consultation with our reproductive endocrinologist, and she told me, don't let them take your tube, we need to figure this out. So fast forward to a few weeks ago, I had the HSG test, which tests if there is a blockage in my tube. There is the Hydrosalpinx, and it has to be removed. I did ask the doctor after that last message if the entire tube needed to be removed or just the blockage, and she said that because it is dilated, there is no way to remove the blockage without leaving a damaged tube, which would not be productive or useful at all in fertility. So she's going to remove the entire tube, which is kind of sad, but she said it really doesn't affect my fertility because I'm not going to be trying naturally. All of my fertility cycles will be manipulated by a fertility doctor. So I guess that's the upside. But it's kind of scary. I have to have that removed. Now, as far as my egg retrievals go, I'm still going to continue working toward having those egg retrievals before I have this surgically removed, because it doesn't affect an egg retrieval, and I really don't want to mess with my ovaries, my fallopian tubes at all, especially because both Sam and I have that low AMH. And so if I don't have a big quantity of follicles that will mature, I'm just worried that messing around in there will disrupt something and I'll have even less. So I would rather just get the embryos, or get the follicles, get the eggs, and then make the embryos, and then I can worry about having it surgically removed. I have 0 plans of carrying right now until Sam has carried successfully and our first child is at least 1 year old. Then we will see if Sam is going to carry again before I do, or if I'll be carrying the next child. So that being said, I don't need to have this thing removed for at least 2 years, but I definitely won't be waiting that long. I'll have the egg retrievals, and then I'll see what works best, I guess. I think that's it with me for a little while, hopefully. I will be doing more of a check-in with my IVF cycles, especially because Sam and I have the same low numbers, so I think it'll be interesting to see how low AMH and diminished ovarian reserve work in two different women within the same family. So I will definitely be logging my journey in the next coming months, but for right now, it's all about Sam. I'm so excited. Woo! Yeah, so if you have any questions about this, I mean, I'm clearly not a doctor, but I do know what's going on with my body at least, and I do Google quite a bit. So if you have any questions about this video or what's going on with us, please drop a comment down below. If you like this or you liked any of our other videos, please do like them. We just want to know that you like them. Yeah, and subscribe. We are trying to vlog our TTC journey and then eventually vlog our family. It's just kind of fun, something to focus on during this whole long process of fertility. I think anybody who's gone through this knows that there's just so much to think about and so much you don't want to think about. So it's really fun to just vlog and connect with people. So if you leave us a comment, then we can focus on that. We can respond to you and we can connect with people that are also going through this. And then we'll just have something to look back on, which is kind of cool. So I guess we will see you on the flip side. Bye! Like it's a bird under your spot.